Hib disease has an enormous impact on child health, particularly in developing countries. It causes approximately 1 out of every 5 severe cases of pneumonia, the top killer of children under 5, and is the leading cause of bacterial meningitis.
Children are dying needlessly due to the infection of these bacteria. We need to stop it now.
About a third of children who contract Hib meningitis will develop a lifelong disability. Treatment is difficult and often comes too late. Antibiotic resistance also limits treatment options in many parts of the world. A safe and effective Hib vaccine became available in 1990 and had remarkable success in developed countries.
There is no vaccine that is as powerful as the Hib vaccine currently available. They're close to 100% efficacious, and they have almost no side effects.
But in the developing countries, uptake was slow, despite efforts to improve access to vaccines.
The offer of Gavi to support Hib vaccines was a huge step forward. The problem was that the offer was a 5-year commitment, so that by the end of the 5-year period, ideally, the country would be paying for the vaccine. The invariable question, and I think I got this from every country I visited, was what happens after 5 years? What am I going to do?
Available surveillance data often underestimated the burden of Hib disease, keeping decision makers from viewing Hib as an important health priority.
Hib is a very challenging disease to document in developing countries. First, because developing countries don't have the laboratory facilities. Secondly, because a lot of children receive antibiotics before they're treated. Thirdly, many physicians don't even believe there's Hib disease in their particular population, so they don't even think about doing the right test.
Successful trials in the Gambia and subsequent uptake in developing countries like Kenya, Uganda and Malawi proved the vaccine could have dramatic impact, even with modest coverage and suboptimal delivery.
This graph illustrated the dramatic result that we got from this study. The incidence used to be over 200 cases per 100,000 children per year. By the end of the study in 2002, the incidence has dropped to 0. The result was dramatic. It was really amazing.
But efforts to introduce Hib vaccine were still hampered by lack of political will and very little advocacy for the vaccine.
It's very difficult when developing country ministries hear one message from one set of donors and another message from other outside agencies, and there are conflicting priorities for what to do with their healthcare dollar.
The Hib experience was not unique. New vaccines tended to be accessible in poor countries around 20 years after they came onto the market. With 90% of deaths occurring in developing countries, that trend needed to change.
It's so frustrating when the people who need them the most don't have access. So in the United States, we've been using Hib vaccine for decades, and yet babies were dying all around the world.
In 2005, the Hib Initiative was created by Gavi to accelerate evidence-based Hib vaccine introduction in Gavi-eligible countries.
When Hib Initiative started, we realized that most countries really didn't understand what Gavi's criteria were and how they would apply for it. It needed a specific group that spent all their time making sure that countries understood the importance of Hib disease.
The Hib Initiative backed research and surveillance of Hib disease to produce reliable data and facilitated the communication of that data to enable well-advised policy decisions.
What the Hib Initiative did is maintained a dialogue with these countries and answer all of their questions and basically customize the answers to the needs of these various countries to help them overcome their doubts about burden of disease issues.
In addition to providing support and technical assistance and coordinating partner activities, the Hib Initiative's advocacy strategy and communication support within target countries was crucial to success.
If there's anything I've learned in the last 3 years working with Hib Initiative, is that we as pediatricians and scientists are terrible communicators. We need help from communication specialists.
communicating the value of the vaccine, facilitating the understanding of the processes by which those countries could access the vaccine with Gavi support, getting local support for planning with local institutions assisted by some of the international agencies. This was a tremendous effort thanks to the HIB initiative.